Autism is a common neurodevelopmental condition that affects children. Children affected with autism have difficulties in communicating with others, interacting with others, and also experiencing the world around them. In India, the early signs of autism are often missed and there is a significant delay in the diagnosis. Hi, I am Dr. K. John Vijay Sagar. I am currently the professor and head of the Department of Child and Adolescent Psychiatry at NIMHANS, Bangalore.
What is Autism Spectrum Disorder or ASD?
Autism Spectrum Disorder is a common neurodevelopmental condition that starts in the early childhood and exists across the lifespan of an individual. Children with Autism Spectrum Disorder, they have difficulties in communicating with others and experiencing the world around them. Autism is labeled as a spectrum condition because there is a wide variation in the symptoms, the skill repertoire, and also the impairment caused by these symptoms. In some children, the impairment is mild, whereas in others, severe impairment is experienced.
What are the symptoms of ASD?
The symptoms of Autism Spectrum Disorder are limited communication with others, limited social interactions, repetitive behaviors like repetitive rocking movements of the body, repetitive hand flapping, and also repetitive hitting themselves, and restricted interest on certain topics where there is increased preoccupation, and also either overreaction or underreaction to certain sensory kind of stimuli like certain sounds or tastes, smells, and touch.
What causes ASD?
There is no single cause for Autism Spectrum Disorder. The aberrant brain development that is seen in children with Autism Spectrum Disorder is believed to be caused by an interaction between genetic and environmental factors. No single gene has been identified as a direct causative factor for Autism Spectrum Disorder. In fact, there are multiple genes that are influenced in the brain development of children with Autism Spectrum Disorder. And the other risk factors include the premature birth as well as very low birth weight, advanced age of either mother or father at the time of conception, and also exposure of the mother during the early pregnancy to certain infections or medications, etc. Vaccines or increased screen time, use of certain diets or use of medications, etc. doesn't cause Autism Spectrum Disorder in children.
How is ASD diagnosed?
Autism Spectrum Disorder is diagnosed through a multidisciplinary clinical evaluation that is carried out by a team of professionals that includes child psychiatrists, clinical psychologists, speech pathologists, pediatrician, neurologists, occupational therapists, etc. The diagnosis involves detailed history taking from the parents as well as a couple of sessions of direct observation of the child's behaviors. And what we must remember is there are no simple blood tests or scans that can be done to do a diagnosis of ASD.
What interventions are available for a child diagnosed with ASD?
For a child diagnosed with Autism Spectrum Disorder, broadly, there are two kinds of interventions. The first one being the center-based interventions that are delivered by trained speech pathologists, occupational therapists, and clinical psychologists. These include speech therapy, occupational therapy, as well as the behavior therapy interventions. In addition, the parents or caregivers have to provide intensive home-based training. A combination of these two modalities will help to achieve favorable outcomes. The role of medications is limited to treating repetitive behaviors in children with Autism Spectrum Disorder and also to treat coexisting conditions like epilepsy and psychiatric disorders. Being aware of the early signs of Autism Spectrum Disorder is important in prompt help seeking that facilitates the early diagnosis and initiation of the early interventions. This will result in better outcomes for a child as they traverse through the childhood and into the adolescence and also when they become the young adults, facilitating adequate level of independent living in these persons affected with Autism Spectrum Disorder.